Winter break is over and it's time for schools to resume in-person learning. In particular, I'm talking about Fairfax County Public Schools in Northern Virginia, as data has shown that Omicron is not as impactful as the news is showing in the health district that we currently reside in, the Fairfax Health District, comprised of Fairfax County, Fairfax City, and the City of Falls Church. Case data shows that the virus is actually spread less when kids are in school than when they're out of school. As you can see in the charts on the screen, you'll see the greatest spikes happen right after the Christmas gatherings of folks. You also note the cases are not spreading exponentially. They didn't before break, and they haven't since. The Virginia Health Department audits their numbers periodically, which is why you see negative numbers periodically. Now, why Fairfax County Public Schools sometimes show numbers greater than the health department, I have no idea, but we'll just take that for face value that there might be a lag somewhere. While the focus has been on the number of cases, when applied to the population data, each age group of school-age kids has a 99.88% chance of not getting the virus on a daily basis, even with increased testing. So when is it enough? Hospitalizations are low. There have been 10 hospitalizations of school-age kids from December the 1st through January the 7th. It's 38 days. The tricky part of interpreting this data, as the CDC recently admitted to one of their studies, is whether these numbers are for hospitalized patients who have the virus or patients who were hospitalized because of the virus. There's a big difference. Either way, 10 hospitalizations over 38 days in a population of over 304,000 persons is low and frankly common during flu season. In all age groups from 0 to 19 years of age, so newborn through freshman in college, there has been one death in the Fairfax Health District since the start of the pandemic, so going back to early 2020. This virus is bad news for the elderly, but not an issue with kids in the Fairfax Health District. Not to minimize any child's death, but the one case happened in the 0 to 4 age group in August of 2021 and had no relevance to students in Fairfax County Public Schools. Are you sick right now? It's probably the flu. The flu is back after being absent in 2020. In fact, we've had 5 weeks and counting in Virginia of there being widespread flu amongst persons in the state. To parents, I would say, allay your concerns. It's not that bad for kids, okay? And most of the symptoms are very mild. For the FCPS administrators, I say, get back to school and teaching in person, and let's keep it that way. Data shows there's no reason for concern amongst parents or teachers, so let's go back to the old normal and focus on education. If you'd like to verify any of the data in the set in this presentation, please review the items in the Fairfax Health Department data sets. Thank you.